Morning, everyone. You're very welcome to the first panel discussion of the day. Very nice to be with you. We're going to be talking about the EU's preparedness for future health crises after the COVID-19 pandemic. My name is Rory O'Neill, and I'm a health reporter at POLITIco. A lot has changed since the pandemic. Outgoing Health Commissioner Stella Kyriakides told us yesterday. The EMA and the ECDC, she reminded us, scrambled to respond to COVID on an ad hoc basis. And coming out of the pandemic, we had a consensus that the EU had a lot of work to do to prepare for the inevitable next pandemic. In response, the Commission created HERA. To the disappointment of many, this was not an independent new agency, but a unit within the Commission. 2 years on, budgets are stretched, health doesn't command the same political attention as it did during COVID, and the future of HERA is far from certain. And all this begs the question, are we really in a much stronger position than we were before? We will hopefully have time to take a couple of questions from the audience, so start having a think about anything you'd like to ask. And if you are following the summit on X, you can use the hashtag #PoliticoHealthcare. I'm delighted to welcome two very distinguished speakers who are going to help me work through some of the issues I mentioned there. We have Rosa Castro, Senior Advocacy Officer at the NGO DSW. And we have, delighted to say, Laura Michel, Director General of the European Health Emergency Preparedness and Response Authority, HERA. Unfortunately, Dolores Montserrat, MEP, cannot be with us due to an EPP group meeting, but not to worry, we're in very good hands here. Thank you both very much for joining me. You're very welcome. I'd like to start with a question for both of you. Maybe, Rosa, I'll go to you first. What should happen to HERA? Should it evolve into an agency? Should it merge with ECDC? Should things stay as they are? I know a couple of months ago, Anne Boucher, former Director General of DG Santé, wrote a memo to the next health commissioner, who we now know, likely to be Oliver Farhelli, advising that they should merge ECDC with HERA. What do you think, Rosa? Do you have a view on what the best route to go down from here is?
Thank you. Thanks so much. Good morning, everyone. And thank you for inviting civil society, I must say, Politico. That's very important. And I don't want to skip the question, but I think the main point here is not for us, civil society. We have been insisting, actually, that HERA should go with big enough budget to act and to fulfill the mandate, with autonomy to act, to mobilize resources. I can tell you a few more details about the budget and what's our thinking there. But in general, I mean, whether it remains as it is, whether it evolves into a sufficiently, let's say, independent agency, it really depends on other factors that probably we don't know as well as maybe Laurent and others can weigh in. I think there has been a few civil organizations that have been very vocal and say it should be autonomous. But the main point is that it should have sufficient resources and the capacity of mobilizing those resources. And very importantly, if we move towards that, towards a very autonomous and let's say, with the power of coordinating HERA, well, HERA should have all the mechanisms for control, for instance, for the parliament, for accountability and transparency of the resources that it invests. I mean, I think one thing that, and then I'll leave the floor also to Laurent, because I'm curious to know if you have any thoughts on this, but I think the reflection of Minister Van den Broek this morning is really, really to the point. I mean, he said, like, EU is all about solidarity. And I think that should apply also to HERA. And because most of the health threats, are global in nature. So think about the pandemics, but think also about climate change as one of the major health threats of our times, with new infectious diseases coming to also Europe, but also affecting other parts of the world. I think we should need to think about global solidarity as well, and how HERA can enact that. I think for that, maybe the answer, I don't skip it that much, HERA should have sufficient autonomy to do these things.
Okay, very good, thank you. I mean, you've mentioned lots of critical issues there that we're hopefully going to get into. Before we do that, Laurent, what do you think? I mean, what is the appropriate or the optimal institutional setup for HERA? Or, as Rosa says, is the really important thing just that it's sufficiently resourced? What do you think?
Well, I think that Rosa is fully right. What matters is the mission, the staff that we have. You have to have enough expertise among our staff and sufficient staff to deliver the mission and sufficient budget. Then the administrative structure is secondary, whether it is within the Commission or outside the Commission in an agency, independent agency, or merge with the ECDC. That's a secondary issue for me. That's my personal opinion. As you know, there is an ongoing review of HERA, and it's up to the President of the Commission to decide based on the document that the Secretariat General has been preparing. We have consulted stakeholders, getting the opinions of different stakeholders, and then the new leadership will take position on the future of HERA. But personally, I think that given our mandate, we are very well based within the Commission, because you need, in time of crisis, to move fast, to be close to the power, because you need to mobilize the appropriate funding when the crisis hits us. You need to be close to the decision makers. And if you look at the new tasks that we have been entitled to, the development of the Critical Medicine Alliance, the Critical Medicine Act, it goes much beyond the current mandate of ECDC. And let me stress also that with ECDC and also with the EMA, we have developed a very good relationship. Of course, when you are new in the system, you have to create your space. There have been some overlap at some stage, but we have signed a memorandum of understanding with ECDC and EMA, and the relationship is working quite well on a daily basis at technical level and also at senior level.
Okay, great. And MEP Montserrat, who unfortunately can't be here, but as a rapporteur for the report on the lessons learned from COVID, one more question on the administrative structure before we get on to maybe some of the more substantial points. She wrote that, if HERA were a standalone agency, it would improve transparency and democratic scrutiny. I mean, do you agree that would be a benefit of that model? And do you have any concerns that the transparency of HERA's work might have suffered as a result of being housed within the Commission?
Well, I've been in the management board of many agencies, including ECDC at the moment. And I don't see why an agency is more transparent than the Commission services. I mean, we go regularly to the Parliament, report on what we are doing. We have, on top of it, in HERA, created a kind of hybrid structure with the HERA board, where we are informing the member states in the HERA board on what we are doing. We have created a civil society forum where we engage with civil society. Parliament has been invited to join also the different groups. I don't see why it will increase the transparency as becoming an agency. I think it's utopia to believe that agencies are more transparent than the Commission services.
Okay. Rosa, can I ask, HERA's remit is really broad. It's leading to work on drug shortages, as we've heard yesterday and today. It procures pandemic flu shots. It's led the EU's response to the Mpox outbreak in Central Africa this year. Do you think it's got a lot of things to balance? Do you think it's got the balance right? And is there any part of its work that you think needs to be given greater prioritization?
Okay, yes. I mean, I think it's very important for HERA to find the right balance, and with the current budget, I mean, unless something changes massively, HERA needs to prioritize, obviously. So, I mean, I think there's a couple of things that HERA could do also within what it has right now. And I think it is going into that direction, but we would like to see even more. One thing is to build on the partnerships that exist, on the lots of organizations that are already active. So for us, for instance, one of these activities that we think HERA should emphasize is the process accelerating the research and development of new vaccines, medicines, and diagnostics. And why? Because there is a big gap. I mean, Europe especially is excellent in the science. There's high level of science. We do have a problem and a gap in converting that science into innovative products. So there is a big gap, and I don't want to repeat things, but we can see it in the big unmet needs, for instance, antibiotics. That's global, of course, but it's also an issue in Europe. So HERA could do something there. Obviously, you require big funding, but there are also innovative ways of financing, and HERA is already looking at this. So, for instance, we are really following the work that HERA is doing on pool incentives for antibiotics, and we think, because we work at global level, and as I said, there are many challenges that we should also see not only as the challenges of low and middle income countries, but as our challenges too. For instance, vector-borne diseases. Because the mosquitoes are coming to Europe, we can expect also that these are threats that will affect us. So HERA can do more. It can partner with organizations, and it is partnering, I think, with organizations such as CEPI at multilateral level, also with Gavi, UNITAID, that also take care of the procurement of these tools. And in doing so, it will kind of do two things at the same time. It could. Right, it could help the European-based biotechs and some of the companies, and also non-for-profit organizations that develop products in Europe. So that's competitiveness, helping these companies. But it can also help at the same time the big issue of access to equitable medicines in Europe, but also outside of Europe.
Yeah, I'm going to return to that R&D point, which I think is really interesting. I mean, Laurent, I speak to a lot of people in civil society. Rosa, maybe you can tell us you agree in a minute, but I mean, I often hear that they had a hope that HERA would be something more akin to like a European BARDA when it was created. Something that makes a really meaningful contribution to global R&D and innovation. Like we all know that that's a point that Boucher raised in her memo as well. I mean, we all know about the massive contribution that BARDA made to COVID vaccines. Just recently as well, like vaccine candidates and therapeutics for Marburg were brought through to the clinical trial stage in Rwanda with BARDA funding. Can you outline how much HERA has been able to do on that part of its work, and is that something that you'd like to do more of, like for HERA to be more of an R&D incubator on the level of something like BARDA?
Yes, I think BARDA is the model that we had all in mind when HERA was created, but with significant more budget than we have at the moment. Let's see if it remains the same with the new U.S. administration. But it's true that there have been, every time there's a new innovative medical countermeasure, there is BARDA fingerprint somewhere. And that's very impressive. And I'd like to have HERA to be the same. And I think we are starting to do that. Look at the new chikungunya vaccine. It was with Horizon money coming from RTD and HERA. So we are there in that space when you mentioned, for instance, climate change-related health issues, so developing a new vaccine. We are funding CEPI, we are funding GARP for new class of antibiotics. So we are increasing our efforts in research. So that's already something good. But I think we should not be ashamed of what we have done over the last 3 years. And you mentioned the Mpox crisis in Central Africa. And if you look at what happened, WHO declared the public health emergency on the 15th of August, just one day after Africa CDC. And 2 weeks later, we were in Kinshasa delivering 200,000 Mpox vaccine, well before the United States, well before Japan. Japan has still not delivered a single dose. And now we are continuing. Last week, we brought 100,000 extra doses from Germany. We are building a Team Europe initiative to support Africa to manage the mpox crisis. So it's true that BARDA was there for Marburg. We were also there. We had been funding WHO for clinical trials for Marburg and Ebola. They were on the spot as well in Rwanda. So we are quite active in crisis management in Africa, and that's important to avoid that the virus spread on other continents. So coming back to research, we have increased our funding in the field of research, and health has been taken a higher part in the overall Horizon Europe budget, and in particular for pandemic preparedness.
Yeah. I mean, Rosa, there's a lot of talk in, continuing on from what Lauren was saying there, there's a lot of talk in Brussels about competitiveness at the moment, as we've heard at this event as well. And I don't know about you, it seems like a lot of people in Brussels, it's kind of all they want to talk about at the moment. Mario Draghi had a lot to say about investing in life sciences innovation. But do you think global health is being left behind to some extent? There's a lot, as you were saying, there's a lot of neglected diseases that primarily affect people in lower income countries in the global south, and there's a huge medical need, but that's not necessarily a profitable market. How do you think we can do a better job of supporting innovation in global health? What are some policies that you'd like to see introduced? There's always more money, right? More investment is always good. Beyond that, are there any policies or models that you would point to as something we could do?
I'm glad you asked, Rory, because we at DSW have been working conscious that there are limited budgets and that things are getting worse and worse. Unfortunately, it happens, I think, a lot of times that after a big shock like the pandemic we went through, we have this cycle of panic, and then we neglect this for a lot of time. It's not the first time that it happens. So maybe we are in this cycle of neglect. Hopefully it doesn't, it's not as bad this time. So what are things that we can do? We have been exploring, for instance, what I just referred to, the long research and development cycle for new medicines and vaccines. Put the challenge on policymakers. So what do you do at the beginning? And it is true that the EU has put a lot of funding. It has actually supported via the Horizon Europe and the predecessor Horizon 2020. For decades, Europe has put funding into development of new tools for neglected tropical diseases. We have a great partnership actually in Europe, the European and developing countries clinical trials partnership, which I hope you know, but I didn't know as well before coming to DSW, the EDCTP. If you don't know it, search for it because it's really important. And it's a model that maybe should be explored further on how it can be even enabled in other areas of the world in the future. So we have been exploring what to do when you have a lot of push funding at the beginning, you have lots of grants, and now we have products in the pipeline that are almost ready but need the last mile. And the last phases of development are quite costly because you have clinical trials, and these are complex and there's a high uncertainty. People from industry will know it even better. And what do? There's a lot of ideas as to pull incentives. A lot of them have been explored because of the development of new antibiotics. We think they should be explored also for tropical neglected diseases. Why? I think there are two reasons. I give you my personal reasons, but I didn't invent them. So there is the moral argument, right? I just told you, EU is all about solidarity. It should also be global solidarity. There is a big burden of diseases in low and middle income countries. So this is real. It's affecting more than 1 billion people. If it's not enough to have the moral argument, there is a second argument, which is self-interest. We are only protected as we protect the weakest link. And that applies globally. So we saw it with Ebola a few years ago, and everyone was scared. Is Ebola coming to Europe? Then we saw it again, and it happened with COVID. And we saw it now with Marburg and Mpox, and maybe it didn't happen, it remained local. But I think we need to continue thinking about that. So pool incentives are those type of mechanisms that could help. We propose one very concrete that doesn't mean upfront, it doesn't need upfront money from the public. It's a program that is being in place in the US for quite a few years, since 2007, and it has worked. It actually helped an Austrian-French company that developed the first vaccine against chikungunya, so Valneva. They obtained this priority review voucher, so they got an accelerated assessment in the US for developing this new product. So the EU could do that. I think it's also about consistency, so it's not only for HERA. This is actually something that is happening, could happen in the pharmaceutical package. So Europe is also like moving towards consistency of the policies. We have the global health strategy, we have a pharmaceutical legislation and package and going on. We should try to align those, right? And help also the work of HERA and help us be better protected for the future.
Laura, what do you think? Do you think you could sell that to the Commission? It doesn't cost anything up front. I mean, I imagine that's a strong argument in favour. What do you think? I mean, like, is there what do we need? Are there any policies that you think would be interesting to try and improve Europe's research footprint for neglected diseases, global health?
Well, I think there are a lot of conflicting priorities and limited budget. If you look at what are the threats at the moment, we have a big threat with H5N1, I think. We have a big threat with cyber bioterrorism, but also state actors. You see what's happening and the threat coming from Ukraine. So we have to be prepared for that. And we have the longer term threat from climate change, and that is coming to Europe with vector-borne disease, but also hemorrhagic fevers. So we have to prepare for all that, and we have limited budget. And what I see is that we all agree in this room. We all speak among ourselves. We are traveling the world, meeting the same people, saying the same thing. But where are we in terms of lobbying the political level? I think the public health community, and I'm quite new in that sector, and it's an attack on everybody here, is very bad in lobbying. Very bad in lobbying politicians, very bad in lobbying members of the European Parliament. Look at the hearings in the European Parliament of the commissioners. There were more questions on animal welfare and equality to Mr. Varelli than on public health. So we need to get public health back high on the agenda. Politicians have forgotten about it. They want to forget about COVID-19. Health is a cost. It's not something seen positive. And we need to raise awareness to get in the next MFF significant budget so that we can face the next threat. They want us to do strategic autonomy, get back generics into Europe, but they don't want to pay the price. And you heard the Deputy Prime Minister, this pricing issue. They want us to get vaccine, therapeutics, diagnostic, PPE for the next crisis. Just a clinical trial for vaccine is 300 million euro. So just how many clinical trials we can fund with a budget, the current budget, which is less than 1 billion euro per year. So that's the reality. So it's important that the whole community raise the issue at political level so that we can get decent funding to do the job. And then we can deal properly with neglected disease. Without that, neglected disease will remain what they are called, neglected.
I mean, it's really interesting what you say, Laurent. I mean, you kind of laid down the gauntlet to all the public health professionals in the room there. I mean, I'm really curious, like, how do you see your role in this? Like, inside the Commission, do you see it as your job to advocate for these issues that we're taught, these priorities? And, how receptive are, you were saying that the politicians don't seem to be very receptive to the lobbying from the public health community. What about from HERA?
Yes, I mean, that's clearly one part of my job, and I'm trying to do it as best as I can within the Commission. But we are, at the moment, also having other priorities like security and defense, and we have a war in Ukraine that doesn't help for the public health budget, and we have to continue to do the advocacy internally, but also globally, and we are all in the same boat, and we have to work together to ensure that we have proper funding for the future.
Yeah, I want to ask, and before we move on to see if there's any questions from the audience, I just want to ask, because we keep coming back to budgets, and obviously this is critical, right? I was wondering what you both made of what we've heard from the two commissioners who are going to have a role with HERA in the coming mandate. MEPs wanted an answer from Commissioner Labib on the future of HERA. She didn't really give a clear one in her written answers. She was asked whether HERA would have an expanded role, and if so, how, given the budget cuts, right? I mean, and she said she would draw on HERA's expertise, and on the question of funding, she said she would extract maximum use of every euro available, which to me does not sound like she expects a great deal more funding coming down the track. I mean, what did you take from the mission letters, the hearings, anything we've heard from the commissioner and the commissioner designate so far? Are we looking at a period of austerity and belt tightening in EU health preparedness?
To me, Roddy?
Sure, yeah.
Well, I hope no. I mean, I hope we learned the lesson that austerity, led the health systems in many countries unprepared and frankly really doing so badly that, many of us suffer, but especially, the most vulnerable suffer. So hopefully not. Hopefully that's not the thinking. And I really, I take the message with us, because I think civil society needs to do more and to do better in advocating for health as an investment, not as a cost, and to stop, let's say, not stop talking to each other, but stop talking only to each other, and go away from our comfort zones to talk to others. I have to say that's very difficult, but we keep on trying. We have it in mind, and you have, I think, hopefully that civil society is there also to push HERA, of course, because that's our role too, to keep on reminding you need to do better and you need to do more, equitable access, this and there. We point this, but we are also there, to support, because we align with many of the goals and overall. So sorry, I think I'm ranting a little bit after the question, but yeah, hopefully not. Hopefully that's not the case.
Okay, I just want to check if we have any questions from the audience. Hopefully we have time for one. We have in the front row. There'll be a mic on the way too. And if you can just say your name, who you're affiliated with.
Thank you. Jasna Karacic-Zanetti from Health Diplomacy Research Unit. So practically it's a comment because I received so many still questions from the people, from the parents, especially for the kids, and about this public trust. And I saw in also my research that there is a still big problem with the public trust, with the vaccine hesitancy, and all these kind of problems. And there are still give to me some question about who is the main authority, ACDC, European Commission, WHO. And when I discussed this with the WHO, it's still like 2 or 3 main authorities, and this is all so confusing for the people, for the public. So if we need to do something, I tried to, I did some evidence-based research, and then I tried to make some protocols about implementing some protocol regarding on evidence-based, but it's so difficult, and we still have so many groups on Facebook about this misinformation, and this is a very big problem, and nobody can stop it. So even we reported that there is a group about, I don't know how many thousand people in this group, and sharing also the news what is not true. And about vaccines, about everything is still, nobody can stop it. So do you have any idea how to stop it? I will try to implement or publish, or I don't know. Thank you.
Yeah, we've got a great panel on prevention and vaccine hesitancy coming up in a little while, but Laurent, maybe you'd like to say something about that. I mean, what is Hera doing any work on combating misinformation, vaccine hesitancy?
No, we are not active in that space. I mean, we are trying to get prepared and ensuring that we get the right medical countermeasures when needed. But that's true that we should maybe invest also in that space in the future to combat disinformation. But I think the best is that we have solid institutions like EMA, with giving confidence to the public that when you take a medicine, you're on safe hands. And we have to combat disinformation on the social media, and that's a real challenge. I agree.
Yeah, Rosa, does that fall under this?
I agree. It's a complex issue, so if you have a panel, that's great. I may say something that because it came during a conversation also with people from CEPI, and they are like very much into this 100-day mission, right, to try to develop vaccines very quickly. And of course, I mean, what's the point of a vaccine if then the vaccination doesn't happen because people is hesitant? So there are not really easy answers, but the fact that they are discussing this type of things, we should be discussing them with communities, with the people, as early as possible is really important. We have, for instance, very good research to come back. A few tuberculosis vaccine candidates that, by the way, need to be pooled, really, and they are being developed in Europe. And we started discussing that because they ask also, okay, we need to prepare, because when this finally happens, we don't work as civil society in research and development just for the sake of it, but because we know that patients need those vaccines. So we need to prepare the ground so that when these vaccines hopefully are developed and authorized by the EMA, people are also willing to take those vaccines. So that's really important.
Great, thank you very much for the question. Very quickly before we finish, Laurent, you mentioned the Mpox response. I just wanted to ask a quick question about that. You were in Kinshasa yourself, I believe, when the first doses of Mpox vaccines arrived from the EU, and I think Hera moved very quickly once the WHO declared a public health emergency of international concern. But the crisis in Africa, the Mpox crisis, has been emerging in sort of plain sight over the past couple of years. Do you think there's more we could have done before the WHO declared a public health emergency of international concern? And can you outline anything Hera was doing in the run-up to that?
Well, we are pushing actually Africa CDC some months before. We had proposed already vaccine actually in April. I wrote to the Minister of Health of DRC, of the Democratic Republic of Congo, already in April, proposing that we support them in the crisis. So, but they were not willing at that time to act because they had other things to manage, civil war, cholera, other crises, and they didn't want to add up with the Mpox crisis. And I think that was a slow response from the African countries when the virus started to spread. But we were already there, we were already preparing, and that's why when the declaration was made, we were ready to act quickly. And that's a lesson learned. We need to be prepared. And if I take, for instance, the example of avian flu, we have already a joint procurement with one company and procured the vaccines with the adapted strain, the current strain that is circulating, so that people who are in contact with poultry, in the farms, can get vaccinated. So preparedness means anticipation, good intelligence analysis, and then be able to react with the tool ready. And we are doing also a number of tabletop exercise with the member states to test our systems to be ready. So it's always an ongoing process.
Thank you very, very much. So unfortunately, we're out of time. But now, next up, we have an interview with Emer Cook, Executive Director of the European Medicines Agency, moderated by our health editor, Helen Collis. Round of applause, please. Thank you all very much.
Thank you. Thank you, Rory.